My name is Feishara Omonuri, and we have in the studios Dr. Joel Akonde, a fertility specialist and a gynecologist. You're welcome on the program.
Thank you very much. Thank you for having me.
All right, yeah, we've talked about pregnancy, mortality ratio, and I think it stems from not having easy labor and delivery, especially in Nigeria, because we've read in developed countries where they have aids to get easy labor and childbirth, and people even schedule cesarean sections and all. But here in Nigeria, we have to go through the pain, and for me, I have an experience of going through 3 days labor before I gave birth, and it's something that could traumatize you for the rest of your life. I'm still trying to heal from that, and it's really something we need to talk about on the program. What do you think we can do to have easy labor in pregnancy?
Well, we are in a very dire situation, a very unfortunate situation. The figure you quoted, let's put it in comparison. The 46 nations you mentioned have a combined 12 maternal mortality per 100,000.
Yes.
Now, think of Nigeria, 814 per 100,000.
Wow.
814 compared to 12 in 46 developed countries. One nation called Nigeria has 814. Women will die in pregnancy-related conditions. In Nigeria, for me, it is a very frightening data, a practical situation which I confront every now and then. As to what can be done, let's go to the root of the problem.
Yes, please.
Number one is personnel. Wherever problem we have in this country, in the world, generally speaking, first, look at the human capital. Look at the personnel. Let me put it in perspective. In this country, as I speak to you, the total number of registered doctors, the complete total number of registered doctors in Nigeria on the list, on register, is less than 90,000.
Wow.
Now, the complete and total number of registered practitioners in nurses is less than 300,000. Now, put it in serious analysis. About 50% of these registered doctors in Nigeria are distributed between Lagos and Abuja. Now, about the same half of about 90,000, half of which are not even in the country. About 2,000 doctors of Nigerian trained doctors are practicing in UK alone. So, which consists of about 3 to 6% of the total number of the UK. Now, when we have from 90,000 to 50% being halved to serve 200 million people, what do you expect? And population of women, Nigeria has one of the highest growth fertility in the world, about between 5 and 6%. In other words, every woman in Nigeria will have about fecundity of about 5 child per a woman. So we have that fecundity, 10 million people as I speak to you and above, to be served by less than 50,000 active, apart from the retired and all those ones, 50,000 doctors, active practitioners, 50% of which are over, say, 10 kilometers from here, where we are, or even deeper into the state, in the riverine areas, in the hilly sides, especially where I come from, where there are no roads. I come from Akoko side, okay, I'm going to be precise. There are no roads, and if a woman is in labor at 2 a.m., how does she get obstructed? By the time she gets to hospital, the head of the baby is on the perineum, is in between the laps, and baby hardly breathing. The woman is bleeding very heavily. The placenta is halfway out, and there is no blood to be given to her. They ask her to go and get money. She has no money. What do you expect? In the next 1 hour, she dies. So, and it repeats itself across the country in difficult terrains, in difficult, even during the day. You receive situation in which the woman is being in labor even for 1 hour. But this is not going to be delivered. Structural issues, there are also ignorance on the part of our people, in which the person that you have been patronizing that is not helping you You are not sense. So, cesarean, and you can see that
The pain.
it should not happen. It should not happen at all. So, now, if that does not happen, in my own facility, I say if I can witness these difficulties in this area, how much, and I tell my junior colleagues that are working with me, I say, how much less areas where there are no specialists. They'll call me in the middle of the night, after birth needs at my attention, I will go there. And I think at 3 a.m. that assuming I'm not there, what is going to happen to this woman?
Can't be there.
So you can see the difficulties. And of course, the other thing is, women folk, some are already ill, they need specialist attention.
Okay.
Some have diseases that ought to have been taken care of. Of course, finance is another issue. Access to healthcare.
Look at a woman. Why is it that labor and delivery is so hard, and what can we do?
Now, when two people comes together to form a baby, he is bringing his genetics, you are bringing yours. You are not the same anymore. The baby inside the individual is not the same. It might be a big baby. So, the physiology of woman is meant, if you look at the shape and bones of the typical African, is slightly narrower than the European. I put these questions to one of my seniors ages ago when I was in training. So when you have to give birth through that canal. The other thing is our mindset as individuals. In the north of Nigeria, a woman in labor, you may not even know she's in labor. And then in the south, it's always noisy, it's, egbamio, that kind of thing. So this cultural conditioning also account. Also, the physiology itself, the woman physiology itself requires that the labor requires a lot of energy, usually about 10 responsibility.
Okay, all right, let's go for a quick break, and when we come back, the good doctor will be telling us what we need to do. This is how to have easy delivery and labor, especially for pregnant women. And the doctor, Dr. Joel Akonde, is a fertility doctor and a gynecologist. And now you need to give us tips. What do we need to do as women, as a professional? You may not be a woman, but at least you've seen women and you know what you can do to ensure that we have easy labor and delivery.
Thank you. I do joke with my clients, majority of whom are women, that I'm now a woman because all my life revolves around women care.
Yeah.
So the first thing is, before pregnancy, care begins before pregnancy at all.
Okay.
Preparation begins before, just as soon as you recognize that you are a woman, you are destined to give birth to another, start preparing. Eat well.
Okay.
Not a big bowl of eba, but a nutritious diet every day, consisting of a little bit of meat, a little bit of fish, a little bit of fruits, a little of carbohydrates, a little bit of protein every day of your life. A lot of water to drink to balance yourself. Take supplements. There is no harm in taking supplements. Folic acid, multivitamins. They are good for you. Women menstruate every month and you are losing iron. Except you are sickle cell or you have Wilson disease or other diseases that accumulate iron, take iron a little bit every day. So when you are preparing towards, that's even before you are now pregnant, register as soon as possible. In fact, once you are recognizing yourself, you become conscious of yourself, you need to know if you have diseases or diabetes, blood pressure, hypertension, thyroid diseases, infection, HIV, hepatitis, syphilis, all sorts of this reproductive tract infection. You must be exercising. You should be exercising before you get pregnant, and improves. Prepare your muscles. You remember I spoke about muscles,
Yes.
and especially the pelvic area,
Okay.
the abdomen and the pelvic area. You will need them. Your hip. You will need them for delivery. You will need them. The abdomen, the hip, and the bum. You will need them for delivery. So prepare them. Exercise. Make them firm. You don't need fat.
All right.
So prepare them, and then improve your multivitamins, improve your folic acid. You only need 1 tablet of folic acid every day. Run away from foods that are not adding values to you.
Junk food.
Foods, highly processed carbohydrates. Run away from them. Eat less meat. Eat more fish. Drink a lot of water. All these carbonated drinks are not for you. Go look for fruits and eat. Eat balanced diet. Eat every day. Your baby needs you. Needs food. Either you eat or not, your baby will take. So when it comes to delivery, of course, I expect you to register. We'll talk about money, but register with a specialist, or in general hospital, or with a private doctor, or with a doctor. In any case, if you are using midwives, they are also trained. Use midwife. When you are not, she's not able, she will refer you, or she should refer you appropriately. So we register with a doctor. If it is a complicated labor or very complex pregnancy, you should be in a specialist's hand.
Okay.
So hypertension, preeclampsia, diabetics, all these abnormal sizes of the pelvis, you should be in specialist hands, in private hospitals or in general hospitals, public hospital. Either of them, the specialists will know what to do. Therefore, prepare for labor, physiotherapy, exercise of the pelvis, and
Okay, what kind of exercise?
you can squat. You
Okay.
can squat and straighten your hips. You can squat. You need the muscles of your hips and of your bum and your abdomen. It's a very powerful muscle that will help you push out the baby.
Alright.
So when these are strengthened, especially in between, before delivery and in between deliveries, you need to strengthen them so that you, of course, it will also improve your sex, as we mentioned earlier. So you strengthen them, and it helps you to deliver safely. Once you lack the vitamins, the food, the energy, the muscles are weak, labor becomes difficult. If there are diseases, and this is where the doctors and nurses comes in, if there are diseases, they should be discovered early and treated without delay whatsoever.
Okay. All right. But then it is also said that some women also lack the will to go through the labor and the delivery process.
That is absolutely true.
Okay. So what do we do with that?
I have some patients who will say, "Doctor, I've had a lot of course, women do gossip. I've had a lot of stories that this is painful. I don't want those pains. I just want cesarean section."
Which is also a good one.
Which is a good one, but we should discourage it because the advantages of vaginal delivery, it protects the baby.
Oh.
Yes, the bacteria that the baby will smear over his or her body
Okay.
is a form of immunity. We
Oh,
develop
okay.
immunity to
Alright.
protect the baby against the likes of asthma, allergies. So it will protect the baby. But in difficult situations, diseases of the body or abnormalities, disabilities, cesarean section, it should be advised. And it should not be the first one. So, but we have a trend, which is a trend, a social trend, that I don't want to experience pain. But again, you said it earlier, I'm not a woman, I might not express, but I'm part and parcel of women now. So, in other words, I care for women every day, I see the pain. And sometimes I tell myself, wow, this is so incredible. You know, labor and delivery is so incredible. And I'm with them all the way. Therefore, the woman should be relieved of the pain.
Okay.
You know, anesthesia, analgesia. She should have enough painkiller to relieve her of the pain that she may be experiencing. If she's dehydrated, I'm sure the doctors will know what to do. She needs to be supported. And she needs to be monitored in labor. The woman may get tired, the baby may get tired, and they should be rescued as soon as possible.
Okay, now let's talk about epidural in Nigeria. How easily obtainable is that?
Epidural is a choice and you should, if you want epidural, it should be planned ahead.
Okay.
your doctor should plan that ahead. You need to discuss that with your doctor ahead of your delivery during antenatal. Doctor, I will need epidural.
And what does epidural do for the people?
Epidural is a form of painkiller.
Okay.
That will lessen the pain. It may not absolutely take the pain away, but it will lessen the pain of labor.
Okay, it's advisable because it's not easily obtainable, especially in general hospitals.
Yes.
In Nigeria, is it advisable? Should it be encouraged?
Well, again, I made mention earlier on that in the northern part of their country, there are women. I have some women. They will have even be pushing without you knowing.
Wow.
So, the individual dispositions to pain. The threshold of pain should be considered.
Yes.
So some women will just say, no, I don't want any painkiller. Some women will say, doctor, right now I don't want to feel any pain. So it should not really be a blanket thing that everybody should get epidural. It has its own side effects. It may increase the rate of cesarean section. Okay. It may cause a little bit of fetal distress. The baby may be a bit distressed and breathless. And blood supply to the womb and the baby may be lessened because of epidural. So it's not completely free. But when it comes to pain, it's a good painkiller.
All right, that's a good one, and I've learned so much. And I'm sure that women outside too are now informed, and so they can make informed choices to have easy delivery and labor. But before I let you go, Dr. Joel Akonde, what advice do you have for the public?
Well, look after yourself. Be aware of your own biology, eat well, treat diseases, treat infections, avoid infections if any. In fact, avoid it. It's your number one enemy.
Okay.
And then if you do have infections and any diseases, diabetes, blood pressure, thyroid function disorders, go to the doctor. If your doctor or nurses are not treating you well, go to another one. Seek a second opinion. I will encourage you, seek a second opinion. Compare and contrast. Read.
Okay.
Self-help books are all over. Internet has opened up opportunities. Read and then seek opinions, genuine opinions. Take the truth and hold it tightly.
All right. Thank you very much, Dr. Joel Akonde. He is a female specialist and a gynecologist. It has been an interesting time today on Health Matters, and I hope you know that if you want to have an easy labor and delivery, you need to start taking care of your body even before you are pregnant. My name is Faye Shara Omonori, and it's bye-bye.